Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and the clinical supervisor for the Gorski-CENAPS Corporation. Today we're in Sacramento, California, finishing the 5th day of our 44-hour relapse prevention therapy training. And it's been an exciting week as ever. And my new friend Matt here has been not only a participant in this training, but he's been the partner that has demonstrated how to implement each of the exercises in the relapse prevention therapy workbook. So Matt, would you introduce yourself to people, who you are, where you work, and why you came?
My name's Matt Stevens. I'm a KDAC graduate. I work for ADI, Alert Driving Institute, and I am a both educator and counselor at the Driving Institute.
Okay, and what led you to come to this?
I came to the relapse prevention program in order to get some better understanding of what the Gorski relapse process is, so I can help my clients in avoiding relapse and acting proactively.
So did you learn anything?
I learned a lot. I learned a great deal.
What would you explain to them a little bit about what this process has been like for you and kind of what you were getting out of the whole week?
What I learned the most was that it is a process, that we looked at several different avenues of people's lives in order to understand what their relapse patterns were. We then refined all of those into a smaller set of relapse prevention cards. We then did some analysis on kind of CBT related stuff as far as actions and reactions, and wrote those down on the cards. And then the final piece of it is we looked at what some of the preventative maintenance or preventative actions we could take in order to either get out of that position once we're in it or prevent it from happening entirely.
Okay, and what Matt was talking about is the relapse prevention warning sign cards are a very specific tool to where people, by the time they finish the workbook, will have between 8 and 15 cards, and on the front of the cards is the problem. And we're doing pure cognitive behavioral restructuring. Matt mentioned CBT, that's cognitive behavioral therapy, but it's a restructuring process. The first side of the card identifies the problem, personalizes the problem, and then what people are thinking, feeling, have an urge to do, actually do, and how they pull others to become part of the problem. Side 2 of the card is where they've learned how to get out of the problem into the solution and develop effective strategies. Today our last strategy was to develop recovery activities to help them manage those signs when they become active. So overall, what's the most important thing you learned about yourself during this process?
Well, the most important thing I learned about myself is that I have to constantly and continually evaluate whether or not I've actually begun a relapse of my recovery. And I did not think that was possible until we started digging into this. And I look back now at my recovery history, and there were several times, even though I did not drink or use, I was probably in a relapse. And with this new process, I can take those cards that we've developed and I can use those in order to either stop going further in the relapse or stop the relapse entirely.
So are you going to go on and get competency certified now that you've had the training?
That is absolutely my plan, is to get competency certified.
And that's what we offer through Gorski-CENAPS, is once people take the 44-hour training, then they go through a certification portfolio review that includes some examination and also taking a person through the RPT workbook, Relapse Prevention Therapy Workbook, and documenting how they implemented each exercise in the workbook. So we're going to be going onward and upward, and remember that relapse is a process, not an event, and this particular training is designed to help people get out of a deadly relapse cycle before they get to the point where they have to drink or use. And Matt, thank you again for your participation and for your help. I really appreciate it.
Thank you, Steve.